Welcome to another deep dive. We've got a stack of sources you shared, and we're ready to get right into the information.
Sounds good.
So the topic today is pretty fascinating and definitely relevant for global health, maybe even investment. The Poxviridae Treatment Market.
Right, Poxviridae. It's a critical area.
Exactly. We've got insights here from a market outlook report. It gives us a pretty clear picture, a snapshot, really, of this segment, where it stands now, where it looks like it's heading over the next, 10 years or so?
Yeah, the source covers the period from 2021 right up to 2033.
Okay, so our mission for this deep dive, we want to go beyond just like the raw numbers. We want to understand what these key trends and growth projections really tell us.
About the fight against these viruses and maybe the wider healthcare landscape, too.
Totally. Understanding this market isn't just about the figures on a page. It's about seeing where resources, where innovation, where that's all flowing. Okay, let's unpack this.
And it's interesting, isn't it, how these specific market figures, they really reflect much broader things like global healthcare investment priorities, maybe shifting public health strategies.
And tech advancements.
Definitely, especially in things like antiviral therapies. The source gives us this powerful numerical lens to see those shifts.
Absolutely. So let's start with that big picture the source lays out right away. The global Poxviridae treatment market, it was valued at, $1,120.7 million. That was back in 2021.
A significant starting point.
Yeah. And by 2025, it's projected to grow to $1,480 million. But the longer-term view, out to 2033, that's even more dramatic. The report expects this market to climb to, a pretty remarkable $581.2 million.
Wow. So that's more than doubling the market size over that whole forecast period?
Exactly.
That's not just minor growth. I mean, it really suggests a market that's, rapidly expanding.
And the source links this momentum to a pretty healthy compound annual growth rate, the CAGR. Globally, it's projected at 7.2%.
7.2% globally, yeah. That's quite substantial over a decade.
It really is. It points to, widespread activity, investment, maybe increasing access to treatments. But the real story, I think, the nuance, comes when you start digging into the regional data.
Which the report does break down, yeah.
So let's start with North America.
Okay. North America. It's currently the largest piece of the pie, you could say, a really strong foundational market for these treatments.
Right.
It generated the highest revenue back in 2021, $467.3 million. And it's expected to grow steadily. The projections are $600.9 million by 2025 and then hitting $986 million by 2033.
So a solid growth trajectory there. What's the CAGR?
For North America as a whole, it's 6.4%, solid, like you said, but actually just a bit below that global average of 7.2%.
Okay, 6.4%. And digging into the countries within North America, the U.S. is, predictably the biggest contributor.
Yes, definitely. Forecast to go from $365 million in 2021 up to $743.5 million by 2033. That's a 6.1% CAGR.
6.1%. And Canada?
Canada follows. Expected to rise from about $65.9 million to nearly $150 million, $149.9 million by 2033. Its CAGR is actually a bit higher, 7%.
Huh. Interesting that Canada's projected rate is a touch higher than the U.S. market.
It is. But then look at Mexico, still within North America. Its projected growth is even stronger, according to the source. It moves from $36.5 million in 2021 way up to $92.7 million by 2033. That's a CAGR of 8.1%.
Wow, 8.1% in Mexico. That really stands out compared to the U.S. and Canada's figures.
Yep.
What do you think could be driving that kind of difference within one region?
That's a great question the data brings up.
Yeah, the source mentions biotech advancements, public health initiatives as global drivers. Could those be having a sort of accelerated impact in Mexico, more so than its neighbors?
That's plausible. I mean, the report gives us the numbers, but connecting them to the why, that requires thinking about those underlying drivers you mentioned. A higher TGR like Mexico's, it might suggest maybe faster market penetration for new therapies.
Maybe linked to expanding healthcare access or specific public health programs.
Could be either or both. Targeted programs responding to specific needs, perhaps. It really highlights that growth isn't, uniform, not even in areas that are geographically close.
Definitely something to keep in mind. Okay, let's move across the pond to Europe. The market trajectory there seems kind of similar to North America in its overall rate.
Broadly, yes. Valued at $325 million in 2021, expected to reach $423.3 million by 2025. And the projection for 2033 is an expansion to $720.2 million.
Okay, and the CGR for Europe?
It comes in at 6.9%, so very close to that global average and slightly higher than North America's overall rate.
Right. So Europe maintains a pretty substantial market size. Does the source break down key countries there too?
It does. We see details for the UK, Germany, and France. Their projected growth rates are all hovering around the 6% mark. Let's see, 5.8% for the UK, 6.3% for Germany, 6.1% for France.
Okay, so that suggests maybe a more mature market, steady, predictable expansion in those big economies.
That seems right. But just like we saw in North America, Europe also has pockets where the growth is projected to be higher.
Ooh, like where?
Well, Italy shows a solid 6.6% per CAGR. Russia is quite active at 7.2%. And then Spain really stands out. It's projected at an 8.5% CAGR. That's one of the highest in Europe.
8.5% for Spain.
Yeah.
Wow, that could mean its market more than doubles, right? From about $21 million in 2021 to potentially $56 million by 2033.
Exactly. And even the collective rest of Europe category shows a strong 7.6% CAGR.
So that split is pretty crucial then. You've got the core markets providing stability, but then these faster growing segments like Spain or the rest of Europe, they're adding disproportionately to the region's overall momentum.
Precisely. And again, this could point back to those underlying factors, maybe regional differences in healthcare policy, maybe disease prevalence, or just how quickly new treatments are being adopted.
Makes sense. Okay, so if we want to see where the most aggressive growth is happening globally, where should we look?
According to the source, we need to shift focus to Asia Pacific.
Right, the market there was valued at $248.2 million back in 2021, but the projection for 2033 is a massive jump to $672.4 million.
Yeah, it's a huge leap. And this region is being propelled by a really robust CAGR, 8.7%. That's significantly higher than North America or Europe.
8.7%. So connecting this to the bigger picture,
Yeah.
Asia-Pacific looks like a massive future growth engine for this whole Poxviridae treatment market, doesn't it, compared to the more established regions?
Absolutely. It's poised for major expansion.
Okay, zooming into the countries there, China must be a major driver.
Definitely. China shows a stellar 9.2% CAGR, forecast to grow from about 88 points.
This audio was created with Podcastle.ai.
9.2% CAGR, forecast to grow from about $88.6 million in 2021 to over $255 million by 2033.
9.2%, impressive. What about Japan?
Japan shows healthy growth, too, of 7.4% CAGR, still above the global average.
Okay, and then India.
Ah, yes. India. The source really highlights India as a key emerging market here. Truly remarkable growth figures.
What about it?
Starts at $29.8 million in 2021, relatively small compared to China then, but it's expected to surge to $92.8 million by 2033. And the CAGR, it's 9.9%.
Wait, 9.9%?
9.9%. That's not just the highest in the Asia-Pacific region. It's the highest AGR among all the individual countries listed in the source material we have.
Wow, nearly 10%.
Yeah.
Just to put that in perspective, a market growing at almost 10% a year, that's expected to more than triple in size over the decade. That's a monumental shift.
It really is.
What does that level of growth in India suggest about those drivers we keep mentioning? Biotech, public health initiatives.
Well, it strongly implies that those factors are converging in India with significant force. This kind of expansion likely reflects a really rapid increase in treatment accessibility.
Maybe fueled by government health programs or a growing private healthcare sector.
Could be. Or even a response to specific public health challenges related to Poxviridae infections there. It's a very clear signal of accelerating market penetration, a market really coming online in a big way.
That makes a lot of sense. What about other parts of Asia Pacific?
South Korea also shows strong growth, 8.2% CAGR. Australia is at 7.9%. And Southeast Asia, collectively, registers a solid 8.8% CAGR.
Okay, so Asia Pacific's story isn't just China and India, even though they're huge parts of it. It's pretty widespread acceleration across multiple major economies.
Precisely. The data paints this picture of really rapid expansion and an increasing focus, it seems, on Poxviridae treatment right across the board in that region.
Okay, let's move on to Latin America. Another region where the source shows solid projected growth rates, often above the global average too, right?
That's right. Brazil, for instance, starts at $19 million in 2021, projected to reach over $50 million, $50.6 million by 2033. That's showing an 8.5% CAGR.
8.5% in Brazil, very strong. Others?
Argentina is projected at 7.7%, Colombia at 8.1%, Peru a bit lower at 6.6%. And Chile is forecast to climb from about $4 million to over $9 million by 2033. That's a 7% CAGR.
So Latin America seems to reinforce that theme we're seeing in emerging markets, often providing these higher CGRs, probably driven by similar factors like increasing access and healthcare investment.
Seems likely, yes, that pattern holds.
And finally, the source briefly touches on the Middle East and Africa. Smaller markets in absolute dollar terms, I imagine.
Yes, smaller overall size, but still showing competitive growth rates in some places. Egypt, for example, registers a strong performance, growing from just $3 million in 2021 to $8.4 million by 2033. That's an impressive 8.6% CAGR.
8.6% in Egypt. Wow.
Yeah.
Similar to Asia-Pacific rates.
Exactly. Turkey also sees this market grow significantly, from $7.8 million to nearly $20 million, $19.8 million, with a 7.7% CAGR. And the rest of the Middle East, as a group, is expanding at 7.2%.
So even in these perhaps smaller markets, the growth rates, especially Egypt's, really demonstrate that this global trend of an increasing Poxviridae treatment market size is reaching across very diverse regions.
It indicates a widespread and seemingly growing need, or maybe just awareness, regarding these infections and their treatment.
Okay, so let's recap briefly. We've seen this really significant growth trajectory for the global Poxviridae treatment market, projected to more than double between 2021 and 2033.
A very dynamic picture.
Yeah. We looked at the strong foundations in North America and Europe, providing stability. But alongside that, these particularly aggressive growth trends driving Asia-Pacific and Latin America, with markets like India showing truly remarkable, almost standout CGRs.
And the source consistently points back to those key engines: advancements in biotech, increasing public health initiatives, and the spread of effective antiviral therapies.
Right. So this deep dive into the data, it gives us a pretty clear picture of a market really poised for, well, rapid expansion. But here's where I think it gets really interesting, connecting this to the bigger picture.
Go on.
Well, we've talked about the numbers, the growth.
Right, and this raises a really important question, doesn't it? When you consider these really striking growth figures, especially the significant differences between regions and even countries.
Yeah, like the sort of moderate 6% ranges in established markets compared to almost 10% in India, or over 8% in Spain, Mexico, Egypt.
Exactly. What does this suggest? Not just about market size, but maybe about shifting global healthcare priorities, or perhaps differential investment in public health infrastructure across the world.
Or could it even reflect, the evolving landscape of Poxviridae infections themselves and the different levels of accessibility for effective treatments worldwide?
That's the key question, I think. How accessible are these treatments becoming, and is that access growing evenly? The data hints at unevenness. Definitely something for you, the listener, to think about. Welcome to the Deep Dive. We've pulled together a fascinating stack of sources today, and we're diving into a market that's maybe more complex and critical than you might first think. The market for treating diseases caused by Poxviridae viruses. Think smallpox, monkeypox, that whole family.
That's right. And what we're really trying to do here is look at the unique dynamics, shaping this specific market. What forces are pushing it forward?
Right.
What significant hurdles are holding it back? And how is it currently evolving?
So our mission today is to really unpack that, to understand the interplay between, say, public health responses, the surprising weight of biosecurity concerns.
Yeah, that's a big one.
And the often challenging path of pharmaceutical innovation in this space. It's a genuinely critical area of global health and security.
It really is. It touches on a lot of different pressure points.
So as we dug into the sources, what immediately jumped out as a major force propelling this market forward? What's driving demand and development right now?
Well, one of the most apparent and certainly recent catalysts has been the global resurgence we've seen with orthopox virus infections.
Okay.
Specifically, thinking about the outbreaks of monkeypox appearing in non-endemic regions, places you wouldn't historically associate with the virus. Yeah.
And that wasn't just a localized event, was it? I mean, that really triggered a significant global public health response.
Oh, absolutely. That response directly led to a surge in clinical research, emergency funding allocations, and crucially, increased stockpiling of the available antivirals.
Right.
Drugs like brincidofovir and tecovirimat, which were already approved or in development, certainly became seen as absolutely essential tools for containment and treatment.
So immediate public health crises clearly drive things. That makes sense. But the sources also highlight another powerful, maybe less obvious driver.
Yes, and this one is less tied to active outbreaks and more to, well, preparedness.
Yeah.
It's the governmental focus on biodefense. Many nations, particularly those prioritizing national security and public health infrastructure, they maintain strategic reserves of Poxviridae antivirals.
And this is directly linked to concerns about potential bioterrorism, especially involving the variola virus, the one that causes smallpox, even though it's technically eradicated in the wild.
Precisely. The potential threat, however theoretical it might seem, it creates a consistent demand. It's not dependent on an outbreak. It's driven by ongoing procurement and the maintenance of these strategic national stockpiles by defense and health departments.
That's a really interesting point. So it's not just treating current cases, but really planning for these worst-case scenarios. What about the third big driver the sources identified?
That would be pharmaceutical innovation itself. I mean, even with all the challenges we'll probably get into, there's ongoing work. People are pushing the boundaries,
Okay.
developing a new generation of broad-spectrum antivirals and also more advanced vaccines.
And was there a specific example from the sources that sort of illustrates this innovation in action?
Yeah, tecovirimat is a perfect example, actually. While it was initially FDA approved specifically for smallpox,
Right.
studies in real-world use have shown it has efficacy against other members of the Poxviridae family, too.
Ah, okay.
This broad-spectrum activity makes it incredibly valuable both clinically, for treating various related infections, and commercially because its utility isn't limited to just one very rare disease threat.
Okay, so those are the key engines driving the market forward. But you mentioned hurdles earlier. Let's talk about the flip side. What did the sources reveal about the significant restraints limiting growth in this area?
Well, perhaps the biggest, most fundamental restraint is, put simply, the lack of consistent commercial incentive for pharmaceutical companies.
And why is that such a barrier here? What's the core issue?
Because, thankfully, widespread, large-scale Poxviridae outbreaks are rare, and when they do occur, they are often geographically limited. So this makes it difficult for companies to justify the massive, long-term investment required for...
This audio was created with Podcastle.ai.
The massive, long-term investment required for typical pharmaceutical R&D pipelines. You just don't have a predictable, large commercial market driven by routine patient demand like you do for, say, cholesterol drugs.
Which often means that essential research and development ends up being underfunded, right? Or at least a lot of the burden falls onto public sector grants and initiatives rather than private investment.
Exactly that. And another very pressing issue the sources highlighted is the concern around drug resistance.
Yeah.
While antivirals like tecovirimat have been effective, there's a real concern about the long-term efficacy, particularly in what are called compassionate use cases.
Can you clarify compassionate use in this context? What does that mean practically?
It's essentially when a drug is used in patients outside of standard approved protocols, often because other treatment options have failed or simply aren't available for that specific patient or situation.
Got it.
Using drugs this way, especially maybe in severely ill or immunocompromised patients, sometimes over longer periods, can unfortunately create conditions where resistance can more easily emerge.
And the severity of this restraint, as the sources point out, is really amplified by the lack of alternative approved drug classes. If resistance develops to the current go-to antivirals,
Then you're stuck.
options for treating severe or resistant cases become extremely limited.
That leaves a significant gap, a real vulnerability. And adding to the complexity is the unique regulatory landscape for many of these treatments.
How so?
A number of them have been authorized under emergency frameworks.
You mean pathways like emergency use authorization, EUA, or the FDA animal rule, things like that?
Precisely. The animal rule, for instance, allows approval based on animal studies when human efficacy trials just aren't feasible or ethical, like for deadly biothreats where you can't ethically expose people.
Okay.
And while these pathways are absolutely crucial for rapid access during a crisis,
They complicate things for routine, non-emergency use later on. Is that the idea?
exactly, it can make global commercialization tricky, it might affect insurance coverage, and it generally slows down or even blocks integration into standard clinical practice outside of a declared emergency scenario.
Which becomes a barrier for access and just general market predictability, I imagine?
Definitely.
So we've got these powerful drivers, but also some really significant restraints. Let's shift our focus now and look towards the future. Where is the market heading? What trends are beginning to reshape this landscape, according to the sources?
Okay. One prominent trend emerging is a move toward what the sources call dual-modality therapies.
Dual modality.
Yeah, it essentially means combining different approaches specifically, using both antivirals and vaccines together, not just one or the other.
Interesting. And where is that approach particularly being applied or explored? What's the use case?
It's seen as especially promising for post-exposure prophylaxis, particularly in high-risk groups.
Ah, okay. After someone might have been exposed.
Right. So administering both a vaccine and an antiviral shortly after potential exposure. The idea is this integrated strategy can offer enhanced protection compared to just one intervention alone, and it could significantly support outbreak containment efforts.
That makes a lot of sense, sort of hitting the virus from two different angles simultaneously. What's another key trend the sources emphasize?
A growing emphasis on global health equity. This is coming up more and more. There's increased focus from international bodies, advocacy groups, making sure that treatments and vaccines for Poxviridae are actually accessible in low-income and outbreak-prone regions, not just sitting in stockpiles in wealthy nations.
And were specific efforts mentioned in the sources regarding this? How is that happening?
Yes, organizations like the World Health Organization, various global health coalitions, they're actively advocating for mechanisms like technology transfer, voluntary licensing agreements, tiered pricing, things designed to make these life-saving interventions more affordable and available in endemic areas where the risk might be higher day to day. It's recognizing that preparedness isn't just about national security for one country, it's truly global health security.
Absolutely crucial. And on the scientific front, is there a new frontier of research that stands out? Something different?
There's definitely a surge in research around what are termed host-targeted therapies. This is a fundamentally different approach compared to the direct-acting antivirals we've mostly relied on so far.
Okay, host-targeted. Can you unpack that a little? How does that work?
So instead of developing a drug that attacks a specific viral protein or enzyme directly hitting the virus itself,
Right.
these therapies target the human host cell mechanisms that the virus needs to use to replicate. Think of it like disabling the factory machinery the virus absolutely relies on to build more copies of itself, rather than just attacking the virus particles.
Ah, I see. So messing with the infrastructure the virus hijacks inside our own cells.
Precisely. And the potential benefits are quite significant because they target our own host pathways, which don't mutate the way viruses do. These approaches could potentially offer much broader spectrum efficacy against different viruses, maybe even different virus families. And crucially, they could significantly reduce the risk of drug resistance developing compared to direct-acting drugs. It represents a really exciting and promising frontier in antiviral treatment. So looking across all the sources, the Poxviridae treatment market is truly operating at a critical, kind of complex crossroads right now.
Yeah, it seems that way. It's clearly being propelled forward by those immediate public health needs. When outbreaks like monkeypox occur, it's definitely driven by state-level preparedness efforts for biosecurity threats.
The stockpiling.
And it's benefiting from ongoing medical innovation, pushing the boundaries of what's possible with drugs like tecovirimat and these newer ideas.
But at the same time, it's also significantly constrained by that fundamental lack of consistent commercial incentive for the pharmaceutical companies. And the specific complexities introduced by the regulatory pathways, like EUA or the animal rule, which are designed for emergency or very rare threats, not widespread use.
Yet the overall outlook the sources present suggests that through continued scientific advancement, like those host-targeted therapies, and, importantly, collaborative global efforts focused on access and equity.
Yeah, that collaboration seems key.
The industry is steadily moving toward a future that's hopefully both more resilient in the face of these threats and more equitable in how it distributes the protective measures we develop. This has been a really insightful deep dive into a market shaped by some pretty unique forces. Here's a final thought for you, our listener, to consider building on everything we've discussed today. Given this inherent tension between the infrequent nature of major Poxviridae outbreaks, which really challenges commercial viability, and the absolutely vital need for constant readiness both for national biosecurity and global health equity, how will innovation and equitable access for Poxviridae treatments be consistently sustained over the long term? Something to think about. Thanks for joining us for this deep dive.
This audio was created with Podcastle.ai.